I'm Dr. Alan Richardson. I think I sent you correspondence, Mr. Webb, over the weekend. I thank you for you and Mr. Steinke replied quite promptly. I think all the other board members had a chance to see that correspondence. I'm a board certified family physician. I'll enter my 23rd year of practice in August. My daughter Sydney is going to be a junior this year at QHS. I think it goes without saying, and I'm going to reiterate a lot of the points I made in my correspondence, but I want the public to hear it. And we're all frustrated. I get that. Mr. Webb, you said that, I'm not sure 100% sure there's any right guidance, and I agree with that. One of my frustrations as a physician, I don't think there's any right answer with any of this. I do know one thing, and I hope I'm wrong. I don't think COVID's going away, and I think we're going to have to live with it moving forward. I'm going to tell you my story. All of my family had COVID last fall. I was in the hospital for 4 days. My wife and kids had it. And we were all subsequently immunized. And I think there's a lot of misinformation about the immunizations. And I don't want anybody misconstruing what I'm saying. I'm not for censoring of misinformation, and I am not for mandatory vaccination. I'm for pro-choice. I'm going to talk a little bit about the vaccines because it's pertinent to what I'm going to talk about. And if you take nothing else from this, for those of you in this room who have doubts about the safety of the vaccines, I would not have had my children, as me being a physician, immunized if I felt they were unsafe. Okay, I want to drive that point home. We know now that virtually all the deaths, all the hospitalizations, and the serious illnesses from COVID are in the unimmunized. That is an undisputable fact. The major adverse effects of immunizations, anaphylaxis, thrombocytopenic thrombosis syndrome, Guillain-Barré syndrome, myocarditis, pericarditis occur in the magnitude of 0.0003% to 0.0008%. The death rate from COVID is 1.6%. I'm not telling you to get immunized, make your own decision, but I think everybody needs to start making decisions on adequate and appropriate information. Let me get to my daughter. This may get a little stern and this may get a little emotional, so I'll apologize in advance. My daughter is immunized because it was the right thing to do. It is to protect her and those around her, and yes, so she can move on and not wear a mask. For those of you in the room, and I don't think most of you know this, Rachel knows my daughter. She was born with a craniofacial syndrome called Treacher-Collins syndrome. She has underdeveloped cheeks, she has underdeveloped chin, she was born without ears, no ears. She has the internal components, but she hears as if you put noise-canceling headphones on her head. That's what she has. Her mom and I were fortunate we were able to have or get her ear reconstruction surgery at an early age, which was purely cosmetic, to try to give her some semblance of a normal ear. In December 2019, she injured one of those ears on a curling iron and had to have 2 subsequent surgeries. And the surgeon said, with the injured ear, there's nothing else they can do. If she injures it again, they can't repair it. In addition to this, she has 2, I'll call them rivets or abutments sticking out of her skull where she attaches her bone-anchored hearing aids. As you can surmise, I am not enthused about putting a mask on her ever. I failed as a father because it didn't come up in discussion. And this poor girl, she's had 9 surgeries in her lifetime, she doesn't complain. I asked her, do you understand your teachers when they wear masks? And she says, it's very difficult. look, we can argue for masks, and I'm sure there's people in this room who want masks, and they're going to argue that kids under 12 can't be immunized. Here's the reality. I think that the stats currently to date, since March of 2020, there have been 20 deaths in individuals under the age of 20 in the state of Illinois. I'm not discounting that. That is tragic, okay? But if we're going to use that as the standard to put masks on, don't let your kids ride in cars, don't let them swim, don't let them ride bikes. They're going to be argued to avoid, wear a mask to avoid the surge. I had 5 teenage boys in my living room last night unmasked watching the NBA Finals. They're going to be argued to wear masks to keep the staff in place. If the staff, who has a choice to be unimmunized, has a close contact, they're going to be taken out. They have to quarantine. They've been given that choice. Look, if you want to protect yourself and you want to protect your kid, you can put a mask on them. If they're of age, you can get a vaccine. Mr. Webb, I think you do a great job. You said in Quincy, we will look out for the safety of our students. I'll do most of that. You look out for my daughter's education.
Thank you. We're a little over right now, Dr.
I'm almost done.
Yep.
Okay? I'm going to make my last point.
That's fine.
I can sum up your guidance in one sentence. And you have it on here. Parents and their children should have conversations about what is best for them